We're really proud to be Buurtzorg's partner in the UK. When we started looking at care at home and trying to reimagine how we might be able to do things differently, we came across Buurtzorg and the Dutch model, and we thought, yeah, it's quite easy to see, it's a very different context. The Dutch are a special kind of people. You know, the Dutch healthcare system is different. It's an insurance-based system there. The teams of nurses are very much going out and kind of winning business. Here, we run a national health service, so it's a different environment. In Holland, the Dutch nurses are looking after, doing a lot of the work, as Alieke described, around that we would call personal care. And that's, of course, the responsibility of social care here in the UK. So there are a lot of differences, and it's easy to kind of get sort of hung up on those. But as we started looking at it, we began to see that actually there were quite a lot of similarities. And talking to Jos de Blok about the reasons that motivated him to set up Buurtzorg, and indeed Alieke talked about the reasons that she joined Buurtzorg from a more traditional nursing care, was that actually the situation is very similar. So nurses were leaving the profession. The costs of health and social care were going through the roof. It was getting more and more expensive. Care was getting more and more fragmented between, you know, prevention, care, and cure. So we started to look at to realise that we were actually looking at the same challenges here, and actually what we wanted to achieve in terms of a vision, in terms of more prevention, people staying well at home, less people going into hospital, less people going into care homes. We shared those with Jos and with the Netherlands, and realised that there was something actually we could do here as well. So we're running some test and learns here in the UK at the moment. We've been working on this since the summertime, getting some tests up and running. So we're preparing tests at Guy's and St Thomas's Hospital. We're doing some work in Gosport as well with a GP locality. Nottingham and Gloucester are also interested in starting some tests and learns in the coming months. So we're focusing on those with the intention. Ooh. Ooh, the challenges are all blank. Oh, whoops, hang on, sorry. So we've been working at those key challenges. Some of those I mentioned about the difference we have, the split we have between health and between social care. We've been looking at the different business and financial models here as well, and sort of looking at some of those challenges. And you know, the Dutch and Alieke talked about trust being a very important part of the Buurtzorg model, and actually trying to introduce a trust-based system to the UK is one of our challenges as well, and about working with organisations that are willing to devolve power to the front line, to actually, you know, particularly frontline staff, actually give them the power to make decisions as they go about their work, which Alieke has been describing to us. I just wanted to put something back to you now, and just wondered if, at the beginning, Alieke talked about at Buurtzorg what's at the heart of their organisation. She talked about it being that relationship with the person that you're caring for, and that caring relationship is really at the heart of Buurtzorg. Would you like to ask Alieke questions? Does anyone have any questions?
Fantastic and inspiring model. I've got a question about where do the funds come from? Because the reason I ask that question is because I suspect some of it comes from government. And then the question is, how do you prevent government from ruining these principles by the things they pay attention to?
Yeah. Okay. Well, the funding is from the health insurance. So that's the way it's paid in the Netherlands. And we just say, well, we will not fill in those forms, but we have our own system. We have a very well organized and formed web-based information from which we can get out a lot of information of the outcomes of our care. And we show them our figures and say, hey, that's it. And well, they are kind of stunned, and so they pay.
So that's right. So the outcomes have been quite spectacular, haven't they, for the government? And they've actually asked youre and Buurtzorg to support other home care providers to deliver it in the same way. And he's kind of affected government in their thinking in that way.
Yeah, but it's really about what do they want to know, and if you think as a company it's really important information, find the way which is easy for your company to show them what are the outcomes. And be brave and say, okay, this is the way we can show it to you. Yeah.
Alieke, Tamsin, thank you. That was really, really inspiring. I think, Alieke, this is a question for you. It was quite interesting to know that you have kind of developed internationally. You've developed new lines of business. And forgive me if I'm wrong, but it sounded like you've got these 800 teams, 850 odd teams, very focused on delivery, and these 45 people as your back office. Having said that, you've developed business, so I'm not quite sure what does your business development process look like? How do you, because it looks like a very delivery-focused organizations. How do you develop at the same time?
It's because organizations of other countries ask us to help. So it's not a kind of plan, so expanding our business. It's people ask us, we want to use this model as well, and please can you help? And well, that's what we do.
And when that happens, what do you do next?
Of course, you need some money for that. And we use this money from the result we have. I think
so it's a not-for-profit organisation, so they're able to invest in innovation and new ideas.
Exactly, so it's about, the result is like 10 million last year. And so this is what we use for innovation, but also, well, helping abroad, getting up new models. And so what we do is, challenging people, for example here, to think, to have a new look at what you want to do, and really start with the core business of what your company is all about, instead of thinking, okay, the system is not working, we have to change this and this and this. I don't know how to explain. Do you know what I mean? No, probably not.
I was thinking that the organisations like the youth work, the psychotherapy, they are similar organisations with care at the heart of what they do, and that's Buurtzorg don't do widgets or something else. It's always about this relationship being at the heart of care.
But also a police organization of the policemen in Holland are very interested in trying to get this model into their organization. Also in the education area, the teachers, and it's not yet there, but so in all the area of public sector, it could work, yeah.
Okay, thank you.
Oh, well.
You can chuck it behind you.
I was first, yeah, sorry. Hi there, thanks very much for your presentation, I really enjoyed it. I work for an organisation and we do preventative work with older people, and we're social workers and occupational therapists. And I was just wondering about the neighbours. I wonder, and this is a question to you obviously, about whether or not people in the Netherlands get more involved with their neighbours.
Not necessarily.
No. Okay.
No, but sometimes it's worth to make an effort and try if it's possible. It's not always working this way, but from this story, for example, I knew about some neighbors. She told me about it, and I didn't know them, and I thought, oh, maybe we can use them. Sometimes I just ring the bell because I think I need some help for this, and I ask. It's not always that way, but sometimes, yeah.
Great, thank you.
So I just want to ask you about your intranet or your Buurtzorg web. So, I mean, how much time do nurses spend putting in outcome data, and do they find it a chore, or are they quite happy to do it? And do you see centralised reports of how all the different units are doing, and where you compare and things like that? I mean, basically, how much information are you having to record, you know, and analyse? Because it's very kind of people focused and it's very kind of about the care itself.
Yeah.
But a lot of large organisations, a lot of people find that a pain to do. I'm just wondering how much of overhead is there for you as a team?
Yeah. Well, so we have this so-called Buurtzorg web, and in it are all the recorded things which are needed. So records we made for the clients, the plans, but also for the hours I spent somewhere. And what shall I say? At the starting point of Buurtzorg, one of the things they were thinking really well of is how can we create a supportive web-based thing. And so, well, they created that. But it took some clever ICT guys, and it also took a lot of discussion with the nurses. So when Buurtzorg started, we didn't have this excellent web as it is now. It started with a simple community thing where we could have some chat. And it started with, I could write down the hours I was working for a client so that the insurance would pay. And I could write down maybe a very small plan for the client. That was it. And now I can use it for everything. And it's built up together with the ICT man and the nurses. And having suggestions and thinking, oh, that's not working. Oh, we will change it. And it still works like that. So it's ongoing, growing. Yeah.
Thanks. I'm just following on. I work in software and IT, so it's very interesting to me. And I just wanted to clarify, the people who are building those systems, are they part of your organization as well, or is that outsourced? And does that make a difference, do you think?
It's outsourced, but they're working closely together.
Yeah.
And so still innovation is going on with this web. And so these guys are very close to the head office in Almelo. And as the nurses all over the country, we can call them if we have a problem with it. Yeah. Answer to your question?
Yeah, thanks.
Yeah, good.
Ready?
Still works. Without managers, how do you arbitrate, or when two colleagues or nurses are disagreeing about something, how do you do that? Is that like a peer-to-peer type thing, or how do you manage those sort of things where a manager would normally kind of step in and make a decision?
Well, basically we do it together. You know, if you have not a manager saying, okay, this is the decision we make and you have to follow if you like it or not, you just have to find a solution together. So then, for example, I have a problem with my colleague. It's not only the problem of me and my colleague, it's a problem of the team. And so we will bring it up in a team meeting and we will discuss them, maybe not one time, but maybe a bit more than one time. And most of the time we find solutions which can, well, where you can live it. Sometimes you find a solution which is maybe not the best one for you, but you can say, okay, I agree on it because the others like it, really. So that's also a kind of culture in the team, that you're not always going for the very best solution for you, or for the manager who think this is the best for all, but that you really try to find something which can fit all, or at least you can say, okay, I can live with it. If not found a solution, we can ask a coach. And she will come alongside and will help by asking good questions, giving suggestions, and having no power to make the decision. But sometimes it really can help if there's somebody from outside who sees the process, give some suggestions, and then you pick one.
So if I may, can I just follow on? So is it fairly just a flat structure? So all nurses are the same pay, same level?
Well,
and if that's the case, how do you do career and how do you do performance?
Yeah, just one step back. If there's really a problem with a colleague and we cannot solve it, the coach can't help, there is one guy who can say, okay, you should leave the team when there's a real big problem, and that's Jos de Blok. So that's one, okay? So for once, a colleague had to leave, serious problems. Okay, so that's how we can solve it at the end. And then it's how making career. That's the question, huh?
Yeah, and like, are you a flat organisation? So if you want to, you know, progress and performance reviews.
You know, the interesting thing, I think that's really also in the culture now of our organisation. Flat doesn't mean that there are differences. There are lots of opportunities to learn more. We have a good education budget, for example. There are colleagues who have a lot of expertise in, for example, I don't know, wound care. And they can put their names on the web and you can find these colleagues. And so they can really work in their expertise area, which they like. If you really want to make career and in a way of getting more money because you have a higher function, well, just don't work at Buurtzorg. But there is a kind of course, you have in Holland, you have those 3 levels of nurses, you can say, 3, 4, 5, with which we work. You have also 1 and 2. We choose not to work with them. So of course you can ask for education. And so if you get to level 5, you get more money than if you get to level 4 of nursing.
I'll just add something to that. Am I on? Yes. Just add to that as well that because they're operating as a self-managed team, it's quite entrepreneurial in their spirit and in how they operate. And so actually there's quite a lot of business skills and entrepreneurial skills that the nurses gain that actually in a sort of more traditional organisation they wouldn't get as well. So there's that kind of development too.
Yeah, for example, that I am here. You know, I could never thought of it when I was working in this other organization. I would have been, I think, 1, 2, 3, 4 steps higher before I could go to England. You know, I'm just a nurse visiting you.
Morning both. My name's John. I work for a large government delivery body. I suspect, like a lot of people here, I work for an organisation that's very hierarchical, lots and lots of layers, lots and lots of managers satisfying themselves that everybody's doing a good job. I wonder, how do you satisfy yourself that you're doing a good job? And how does your organisation let 10,000 people know what kind of job they think they're doing?
I don't get it completely. You, maybe?
I got the first bit.
Sorry, yeah, okay.
Yeah, so the first bit was how... no, go on, say it again, please.
Yeah.
How do you satisfy yourself that you're doing a good job?
How do you know at the end of the day you've done a good job?
That's a nice question.
Yeah.
Well...
Sorry.
Probably...
Happy clients?
Huh?
Happy clients?
Yes, of course, happy clients. You know, I think I have to look back to see what makes me happy now and satisfied now. I was in this former organization and there were a lot of complaints of those clients and I was working very hard. I was really trying hard and my colleagues too. And still there were so many complaints of the clients. Now, really, we don't have complaints of the clients. Of course, some people are difficult to deal with due to their psychiatric disease or whatever. But we don't have those complaining clients. And you know, it makes me so happy. And of course, there's also this check of your colleagues if you work according to the nursing standards. You see, so because you have a close team, you can give feedback to each other, and we do, yeah.
And just to add to I think the final question was about how do you know that 10,000 nurses are doing a good job?
Yeah, what does the organisation do for you to let you know you're doing a good job?
And that's really visible through the Buurtzorg web itself that Alieke was talking about. So it's very transparent, the information that Alieke puts on there. It's transparent to her own team members. But any team can look at any other team's system as well and see what they're up to and what their kind of outcomes are and the kind of interventions they've been doing. And so Jos is the back office. they're also able to access all of that data for the whole country. And use it as a communication channel and feedback, and to, you know, test ideas and thoughts and thinking as well. So it's a kind of really good indicator of what's happening on the ground, both in terms of the organisation and the nurses, but also patient care as well.